Our behaviors determine a large part of our health, good or bad. Why is it so hard to change behaviors? The goal of health education is to provide the knowledge and skills to help people change their lifestyle. The goal is for them to adopt behaviors that help them become healthy and stay healthy. Health experts estimate that 50% of health status is determined by lifestyle. So teaching people to eat better, exercise more, drink responsibly, avoid drugs and tobacco, wear a helmet when riding a bicycle or motorcycle, drive safely, manage stress positively, and stay out of the sun leads to healthier lives. Chronic diseases are among the top 10 killers of Americans today. Because most are lifestyle-oriented, they are preventable for those who adopt healthy behaviors. Yet, mortality and morbidity rise every year, so it's evident that knowledge does not change behavior. Further, attitude does not change behavior. In fact, even the threat of death does little to change behavior. The leading causes of death in America are heart disease, stroke, cancer, diabetes, unintentional injuries, intentional injuries such as suicides, lung diseases, and other chronic illnesses. Most recently, added to the list is a source called iatrogenic diseases. Iatrogenic means unknown. That means more people who stay in hospitals or who see doctors are dying of unexplained causes. People are dying as a result of hospital stays. Patients pick up deadly infections from Staphylococcus bacteria. People suffer more or even die from staying in hospitals or as a consequence of misdiagnosis. Most of these ailments are related to lifestyle, including choosing the wrong caregivers, whether unknowingly or knowingly. Most are completely preventable, yet very little effort goes toward teaching and convincing people to take better care of their health. Technological wonders have been invented to help doctors diagnose cancers, but there are still relatively few tools available to effectively cure cancer patients. When will we learn? Western scientists and physicians argue that technology has greatly advanced modern medicine. There are machines and computers that can see through muscle and bone. It is now possible to grow skin in a lab and graft it to the body. Surgery is performed on babies in utero. These are wonderful modern medical miracles, but they are all about treatment rather than cure. In fact, it seems the more advanced medicine becomes, the further it is removed from helping patients heal themselves. Advancement seems valued by the human race, even though the result is a progressive inability to care for ourselves. Please understand that I believe it is important to treat illness, and I'm so grateful for technology that reduces suffering. However, I advocate for at least the same amount of energy to be exerted toward teaching self-help. Well, there's my health educator soapbox. Why does this approach seem to be ignored in traditional medical practice? Well, for one thing, pharmaceutical companies spend vast sums of money wooing doctors to use their drugs. For another, doctors are so overworked that writing prescriptions is considered the most efficient means of treatment. And of course, time is money in any business enterprise. It takes valuable time to perform extensive interviews that allow doctors to really connect with patients. The consequence of efficiency is that most patients find doctors uncaring and lacking in human connectedness. Yet, few complain. We are all too ready to get a pill from a doctor when sometimes chicken soup would do. Back in the old days, when you got a cold, Mother tucked you in bed and brought you chicken soup. You took a nap and rested. Your body took some time to heal. You feel better. All you needed was some tender, loving care, rest, and chicken soup. Till today, there is no cure for the common cold, but chicken soup still reigns as an effective treatment modality for all those who believe. Is this the health care you need? Sure tastes better than pills. How long did your doctor spend with you on your last visit? How much were you able to tell her about what bothers you? Patients willingly let a person cut into their body who has spent less than 10 minutes with them. Neither party seems to expect a person-to-person connection. Yes, pharmacology is highly advanced, but it's at the price of self-care. I disagree with the notion that we are a healthier society if that health is purely based on advancements in medical technology. After all, despite modern diagnostic tools and science-based treatments, we are no closer to eradicating illness and poor health. In fact, the over-reliance on medical science to solve health problems may actually increase the incidence of poor health. Think of patients who become dependent on medications and treatment. It's disconcerting that many current drugs, statin drugs for cholesterol reduction come to mind. They amount to a lifetime prescription. Patients who end up becoming dependent on a drug for the rest of their life create an efficient source of income for drug companies. But of even greater concern, it diminishes the ability to care for yourself. The inconvenient truth is that the more advanced we become, the less capable we are of exercising self-reliance. In summary, the philosophy underlying allopathic medicine has not changed too much over time. It focuses on treating illness rather than promoting wellness. Bottom line, the business of diagnosis and treatment is more lucrative than the business of prevention and cure. The money stream ends if patients are actually cured. That's not to say that allopathic medicine is a negative force. Rather, while treatment of symptoms is indeed necessary, allopathic medicine would be an even greater benefit to society if it is more compassionately addressed to the overall health and well-being of all whom it serves. True health care requires treating the patient, not just the disease, and doing so in such a way that you can take care of yourself as well. That means caring not only for your physical, but also emotional and spiritual well-being to create a sustained sense of integrated wellness. I assert that modern medicine needs a little tender, loving health care. Hypnotherapy helps you to take care of yourself. Hypnotherapy facilitates your healing. Hypnotherapy contributes to your health.